connection. It is me, Molly Maidenblick, again with the American Cancer Society Cancer Action Network. So, I just had this thought come to mind since we are having a guest from the American Cancer Society. And so maybe I'll take a chance to explain a little bit about the difference between ACS and ACS CAN for those of you that might be a new listener to this podcast. So I work for ACS CAN, which we are a part of the American Cancer Society, but we are the American Cancer Society Cancer Action Network. So we are kind of the advocacy side of the American Cancer Society. So we're a little bit of a different nonprofit, which allows me to do more advocacy work at the state legislature and at the federal legislature. So I can go in there and talk to legislators a little bit more often. And the American Cancer Society has obviously other roles that they do very, very well. And this is the part that I get to focus on. So that's why we have that CAN at the end of the ACS CAN. So, but I'm really excited for not just our American Cancer Society guests, but our Karmanos guests as well. And everybody that we have more than just one speaker today, and I'm very excited about it. So I'm going to pop them onto screen and let them introduce themselves here. So 1 second here. Hello, ladies. Thank you all so much for joining me today.
Hi.
Thank you.
Thank you.
So Megan, since I kind of gave you a little bit of an introduction, I'll start with you. Yeah. Do you want to introduce yourself and what your role is?
Yeah. So my name is Megan Landry, and I work with the American Cancer Society. I am the senior manager of our patient support team, which means, because that's not always easily defined, that I work with the health systems, federally qualified health centers, and health plans in Michigan to increase screening rates, to work on cancer prevention, to support patients with transportation and lodging needs. And I've been with ACS almost 9 years.
And she holds my hand a lot to help me figure out what I'm supposed to be doing. So thank you, Megan. So I'm just going around on my screen. So Celeste, would you like to introduce yourself?
Sure. I'm Celeste Titus. I am with Karmanos Cancer Center as the screening and prevention administrator. So Tamika and myself we run and manage the screening and prevention program. And we're excited to be here and explain what our new program is all about.
Well, thank you. As I'm choking. And last but not least, Tamika, would you like to introduce yourself?
Sure. My name is Tamika Lamrani, and as Celeste mentioned, I'm one of the screening administrators also at Karmanos, and we service both our Detroit and Farmington Hills and Maumee locations, and we just manage the screening program and build awareness around our community.
Yeah, well, wonderful. So that is kind of what we're focusing this podcast on today, and so we appreciate you guys being here to explain this, because I am going to learn as much as our viewers today, I think. So I appreciate you guys again being here. So Celeste, I'm going to address the first question to you, but anyone obviously feel free to jump in. But hopefully this is kind of a softball, a lob to you a little bit. Why is it so important for people to get cancer screenings?
So cancer screenings are very important in your health journey because early detection is really the key to success with cancer. Early detection means better outcomes long-term, and there's more treatment options available if you have early detection. So working with your doctor to identify which screenings you're eligible for and getting those done, as recommended is most important to have the best outcomes for your treatment if you should be diagnosed.
Sure. Makes sense. I think we hear that, but sometimes it's, so important to be reminded of that. And really, we're not just saying it. Like, it really is important to get screened, and that early detection is very important.
Yes. To take care of yourself along the way. It's where everyone's always caretakers, but really looking at your own health in your life and taking, that and owning it is a big part of your life.
Yeah. I like the way you said that. That makes sense. All right. So, Tamika, what cancer screenings should people make sure that they schedule? So especially with the new year approaching, some people are looking to schedule those doctor's appointments for the year, and others, it's New Year's resolution. They're making a resolution to do more for their health. So again, what cancer screening should people make sure that they should schedule?
Well, yeah, I think as everyone's trying to make their New Year's resolutions, it's always a good idea to start getting those appointments scheduled with their primary care physicians. And asking about, what screenings they can get or what are they due for. So for women and men, we ask them to Check to see if you are up to date on your colorectal screenings or your lung cancer screenings. Of course, there's some eligibility with, all of the screenings that we have. But they can always discuss that with us or their primary care physicians. For males, we also encourage them to, if they qualify or they're at the age of 50 or over or at high risk, to get a PSA or prostate screening. And then for women, also breast screenings or get their annual mammograms, and then also cervical screening, so getting their pap smears. And then just talking through that and doing that with their primary care physicians and when they're due, so that they know this is something that they can do annual or if it's every 2 or 3 years.
Sure. Yeah, that's a really good point, because I think some people, if you don't know, do I need to do this every year? Or, I just did that last year, right? Do I need to do this again? But it's important to talk that out with your doctor as well. And they'll definitely let you know. And, especially if you fall into a category where you should be screened more often. So, okay. So Megan, I'm going to kind of turn to you a little bit, and obviously anybody feel free to hop in a little bit to tell us a little bit about the recent screening event. So my understanding was a collaboration with, ACS and Carmanos. So can you tell us a little bit about what that event was, what screenings you guys offered?
Sure. So the event was called Screening Saves Lives, and I'll let Celeste and Tamika jump in a little bit to talk about what was offered and how many people were screened. But I'm just going to back up a second to say that kind of early on in 2022, my team started a program called Breast Health Advocates, where we were training women on how to talk to women in their community about getting screened. And one of the things that they kept saying is, we can talk about it all we want, but we also need to tell them where to sign up or how to get one. Yeah. And we're hearing that they don't have time during the week or they don't have childcare. And so I started working with Carmanis on hosting an event where we could bring women to. We could say, well, we have an event where you can come get screened. So it started off as just being breast screening, but Carmanis, being amazing as they are, we're like, you know what, we're going to have head and neck screenings. We're going to have colorectal consults. So at this point, I'll let Celeste and Tamika jump in, but we had our breast health advocates at that event talking to women about getting screened and services that the American Cancer Society has. So that's all. Yeah.
Great.
The event was awesome. It was in October. As Megan said, it was called the Screening Saves event. And once we sort of got the idea rolling, we sort of just started snowballing it. And we were very excited to kind of create a check the boxes for all of our community that wanted to come in. And we did offer head and neck screenings, oral screenings, which is part of the head and neck screening, and then colorectal intake appointments for the colonoscopy, and then the mammograms as well. So patients were able to just come in and do all 3 of those in one day, which a lot of patients did. And we screened over 160 patients in that one day, which was definitely beyond what we thought was going to happen. And we were very excited with the outcomes that came from it. And we had a very good response from the community as well. So we're really hoping to continue that and partner again to do something similar moving forward.
Yeah. Wonderful. So I don't know, did we just...
Might have lost
Tamika. So, well, she hops back on. We'll clue her right into the conversation. Okay. But so I know. Hold on, I might have. Oh, you're back, Tamika. Sorry, we lost you there for a second. So you didn't miss much other than us just being like, "Uh-oh."
That's okay.
So I think, Celeste, you had pointed out that you had screened more people than you guys had originally thought might actually come to this. So were there any goals that were kind of set forth by either Carmanos or the American Cancer Society that you guys...
I wouldn't say we had a number set for patients per se, because we were really kind of just trying to bring it all together. But our goal was really to increase awareness and just increase our screening numbers as a whole. And we definitely did that. So I think our goal was definitely met. And just in terms of the response from the community with coming in and just receiving an education component as well. We did have a lot of participants just come in for the education component, which was great. And just to understand the different services and that we have available and partnered with American Cancer Society.
Great. So this might be a silly question, but like physically, where was this? Did people walk into, like, what city was it in? Was it a hospital? Was it at Carman?
It was at our main campus in Detroit. Okay. It was held in between of our clinics. So we did do the head and neck screenings in our main clinic, and our mammograms were done there in the clinic. So we just kind of opened up our building on a Saturday, and which I think was great for a lot of people who do work, and it is difficult to come in during the work day. So we did open up on Saturday, and I think that was part of the response, was that people said that they needed more flexibility, and this was a good opportunity for that. So we heard that, and we want to make sure that we offer that moving forward. So definitely, our clinics are open on Saturdays for mammograms, I think twice a month. But making sure that we try to get all those screenings in one day for patients is a goal of ours. And it was a great event.
Yeah. So Megan, real quick, can you help with me thinking of, like, how does, like, the American Cancer Society, like, get the word out for something like this? Or, do we kind of have a role in something like that? Like, what did that look like on your end?
Yeah, so the breast health advocates that we had flyers for this event, but also just flyers on, if you can't come to this, here's how else to schedule your mammogram. And there were several women that scheduled it through that other avenue. But we had our advocates go where they are already going, because one of the things that I've learned in my time at ACS is that we have to go to people. No one's going to knock on my door and say, I need a mammogram. Where do I go? So we were going to churches. We worked with the Wayne State Mobile Health Unit, which goes into neighborhoods in Detroit. And they had flyers for the event. So as they were talking to people and said, hey, do you need your mammogram? Here's an event you can go to. So we definitely used like grassroots effort with our volunteers.
Okay, cool. Yeah, that's great. So what can we look forward to in 2023? So are you guys planning more of these kind of events? Or I'm, very selfishly thinking, I'm on the other side of the state from you guys. I'm on the west side. So, can we do anything kind of around the state, or is that not really, am I asking the wrong crowd here? So
I mean, we welcome everybody to do these types of events. Yeah, I do think that Carmanis is planning another one, but I don't know if Celeste and Tamika want to jump in for that.
Yeah, sure. Either one of you.
Yeah, we definitely are planning to carry on the Screening Saves events. So we are going to be holding another Screening Saves events in 2023, which we're really excited about, and trying to make it bigger and better for everyone. So we've already started trying to organize it, and also just, starting off the beginning of the year with getting the word out, some awareness to communities, and building on, everyone, just so they can know that if they need these type of screenings, they can come to Carmanis. They don't have to wait for an event, but we will make those opportunities available, make it a little bit more flexible so they can still come in on Saturdays, not only just for our Screening Safe event, but, maybe even throughout the year, making that an option for people where it's more convenient if they work during the week. And then also, expanding on some of our other locations. So, not only Detroit, but we have Farmington Hills, and, been doing some renovations there as well. So just making sure that everyone knows that they can get their screenings through us. And there's more than one location, and they don't have to wait for an event. They can always come.
Yeah, that's fair. Sometimes we focus a little too much on meaning maybe me, like, oh yeah, this event, but you can do this. We obviously would recommend that you do this regularly. You don't have to wait for an event for this kind of, the importance of getting a screening. So, all right, anything else that I missed that you guys are planning for 2023 that you want to announce live here today?
Not an event, but I do want to add in that if you don't have a relationship with a primary care doctor, you can always call us at Carmanis, and we will help you get that figured out to get a screening. So a lot of people, I think the healthcare system is difficult to navigate. And if you don't have a primary care doctor or somebody that you feel comfortable going to talk to screenings about, they can always call 1-800-Carmanis, and we can make sure that we help you get those screenings scheduled and determine eligibility, and also have them done with us. So just make sure everyone remembers that you don't always have to go to a primary care. If you feel kind of lost in what you're doing, just reach out and we can help. Yeah,
that's a great point. You kind of, anticipated a little bit of what I was going to kind of talk about, because, maybe I shouldn't be saying this, but now that I work for ACS Canada, you kind of realize the importance of all this, and, it's more readily available. It's on my mind. Right. And I get to work with people like Megan, and then, more people at Carmano. So it just seems more available to me. But before any of this, I would have no idea where to go, right? And you're
Yeah.
right. There's a lot of people who don't have a primary care doctor, or
Yes.
the first time you need to see a doctor, you're like calling 13 of them because they're all busy and they're
Yes.
not seeing new patients. And you're just like,
Yes.
I don't know what to do. So I think that's really, really important. Celeste, so can you repeat that? Like how could someone,
Yes.
where would they
So
go
if you to come to
Carmanis?
Carmanis, you can always call 1-800-CARMANIS, and we can always get you connected and with someone to speak to. And then we can always utilize carmanis.org/screening. That's also an option to talk to us. And you don't have to be a cancer patient to come to Carmanis. We do screenings and we can help you if you don't have a primary care. And I just always encourage people, don't wait until you're having a problem to reach out for some help. You know, if you just want to talk about screenings or eligibility, just call and may have the conversation, and then we can get things going for you. And I think there's also a lot of fear around screenings as well. But the first step is just making a call and getting it on the books.
Right. Yeah. Megan, I don't want to put you on the spot, but is there anything that you kind of want to add from the American Cancer Society point of view on getting people screening and like the work that you and your team kind of specifically do around this?
Yeah, two things. One, Celeste brought up the barrier that people sometimes say, which is I don't have a primary care doctor. So we had our breast health advocates kind of trained on everything that people could say about screen. I don't have a primary care doctor. I don't know if I'm eligible. I don't have transportation. I can't go during the week. And we had solutions. Or I don't have insurance. Well, there's a program in Michigan that can help pay for your mammogram. So I really love the breast health advocate program, and that they are going to where they're already going and talking to women in their church, in their gym, where they get their hair done, about getting screened. Because I think that when they build that trust and are talking to women in their own community, they're getting them to be screened, which is so important. But yeah, it is a huge focus of ACS of getting people into screening. Celeste mentioned, the earlier you're diagnosed, early detection, and during COVID, so many people put it off. So we have a Michigan Cancer Prevention Task Force, which Carmanis is part of, as is 40 other organizations across the state that are all working on this together. Like, we all see that this is a problem. So how are we going to collectively make opportunities for people to get screened?
Yeah. Well, this is why I kind of like this idea of getting you guys, like, you are individuals, you are human beings, you are people. Because sometimes, Megan, for like, it's the American Cancer Society. Well, of course, the society is telling people to get screened. Right. But like, you are a person who's out there talking to advocates who are talking to their friends. This is important. This isn't just the American Cancer Society or Carmanis, telling people, like, you three are there, doing this for people and making sure that they know the importance of it. And it's not just big organizations saying words. Hopefully this, means something to people. So, okay. Tamika, is there anything you wanted to add? I kind of let Megan say something. So.
No, I want to say ditto. I just think that what we're doing right now and what the American Cancer Society is doing is so important to our community. And we do want, people to know that there are options for them. And, not only just that barrier of having a primary care, but we find is a big one is just fear of the unknown. We just always encourage everyone to, it's just one little step, and these screens are very easy. They're either a scan or, just some imaging that you have to get done. And most of the appointments are just 30 minutes. So it's just that little time that you can take out of your day to get screened and just, do something for your own personal health and look out for yourself.
That's a really good point. I didn't touch on that. Ask that question about kind of what do these screenings look like, but it sounds like it's pretty painless, 30 minutes. So yeah, it should be, I don't know, just know it myself. Like, like, what am I walking into right now? Like, is this going to be painful? Is this going to be awkward, uncomfortable? Kind of, so that's very important, I think, for some people who have like social anxiety.
Yeah, they're painless.
Yeah.
Wonderful. All right, Celeste, I'll give you the last word. Is there anything else that you wanted to add? I know you kind of did that.
I'm coming at the tail end, but I want to thank you for having us here and encourage our community to reach out to us at carmanis.org/screening. We're happy to answer questions, and no question is a silly question. So if you just want to call in and talk about, what you have going on or how we can work with your primary care physician, we're happy to do that. So just reach out and just take that first step, and we're here to help.
It's very important. Everyone listening or watching, there is no silly question. I've asked all
No.
of them, and all these people are very nice to me. So, so all right. Well, thank you three very, very much for explaining not only the event, but how important cancer screening is. And so for taking this time. We're so close to Christmas, but we just thank you guys. I hope you all have a wonderful holiday season, and thank you again.
Thank you so much.
Yeah, thank you for having us.
Bye, everyone.
Bye-bye.